In recent years, we've seen the incredible strides that medical robotics have taken in, transforming not just surgeries, but the entire recovery process for patients with severe injuries. This revolution is not just a technological achievement, it's reshaping the very nature of how we think about medical care, making what once seemed impossible a reality in our operating rooms and rehabilitation centers. Take the Vinci Surgical System, for example. It's one of the most well-known advancements in robotic-assisted surgery, and it represents the pinnacle of precision in the medical field. As surgeons, we've traditionally been limited by the natural tremor in our hands or the constraints of the human wrist. But with robotic systems like Da Vinci, these limitations are being removed. The technology allows us to perform incredibly complex procedures through small incisions with unmatched accuracy, reducing the potential for human error. We've all been in surgeries where the tiniest misstep could have led to complications, especially in operations like neurosurgeries, where every millimeter counts. But with robotics, we now have a level of control and finesse that was unimaginable even a decade ago. The system magnifies the surgeon's movements, filtering out any tremors and allowing us to work with instruments that can rotate in ways our hands physically cannot. These advancements have translated into faster, more efficient surgeries with less blood loss, reduced pain, and a shorter recovery time for patients. This is where the second phase of this revolution comes in: recovery. We often talk about surgery as the critical turning point in a patient's journey, but the road to full recovery is just as important. Traditionally, patients recovering from severe injuries or invasive procedures would face long periods of immobility, which can lead to muscle atrophy, joint stiffness, and, in some cases, further complications. But today, robotics is stepping in to change this narrative as well. Robotic rehabilitation systems are emerging as game changers in the world of physical therapy after a patient undergoes surgery, especially for traumatic injuries like spinal cord damage or major bone fractures. The body needs to relearn movements and rebuild strength. Traditional rehabilitation methods can be slow and labor-intensive, relying on manual exercises and the physical strength of both the patient and the therapist. But with robotic exoskeletons and assistive devices, we now have tools that can help patients regain mobility much faster. For example, patients who have suffered a stroke or spinal cord injury may be unable to walk on their own. With wearable robotic exoskeletons, they can now practice walking in a controlled, safe environment. These devices can provide the necessary support to stabilize their movements, allowing them to engage in therapeutic exercises much earlier in their recovery process. And the beauty of these systems is that they can be tailored to the individual's needs. The exoskeleton can gradually reduce the amount of support it provides as the patient regains strength and coordination, giving them a personalized path to recovery that evolves over time. Moreover, the integration of robotics into physical therapy isn't just about physical support. Some systems come equipped with sensors and artificial intelligence that track the patient's progress, providing real-time feedback to both the therapist and the patient. This data-driven approach allows us to adjust treatment plans based on the patient's specific needs, leading to more effective and efficient recovery outcomes. We've also seen the introduction of robotic systems that assist in tasks like limb replacement. Patients who have undergone amputations can now benefit from advanced robotic prosthetics that offer a level of dexterity and control that mirrors natural limb movement. These prosthetics, combined with neural interfacing technology, allow patients to control the prosthetic with their thoughts, opening a new world of possibilities for those who have lost limbs. While we're excited about the potential of robotics in surgery and rehabilitation, it's important to acknowledge that we are still in the early stages of this transformation. Research and development in medical robotics are moving quickly, but there's much more to explore. The integration of artificial intelligence, machine learning, and real-time data analysis could take these technologies to even greater heights in the near future. We envision a future where robots can assist not just during surgery or in post-operative recovery, but in every aspect of patient care, from diagnosis to long-term health monitoring. Imagine a hospital where robots perform routine tasks, allowing doctors and nurses to focus on the more complex human elements of care. Or picture a world where personalized robotic systems can follow patients home after surgery, continuing to assist in their recovery process in the comfort of their own space. These are the kinds of scenarios that are on the horizon as we continue to push the boundaries of what medical robotics can do. In the meantime, we are already witnessing how these technologies are dramatically improving patient outcomes. Procedures that once required long hospital stays and came with significant risks are now being performed with fewer complications and faster recovery times. Patients who once faced permanent mobility loss after catastrophic injuries are now walking again, thanks to the power of robotics. It's an inspiring time to be a part of the medical field as we stand on the edge of a new era where human skill and technological innovation are coming together to achieve unprecedented results. So, as we continue to explore and refine these technologies, one thing is clear: medical robotics is not just the future of healthcare. It's already transforming the way we operate, heal, and recover today. And we're just getting started. In recent years, we've seen the incredible strides that medical robotics have taken in transforming not just surgeries, but the entire recovery process for patients with severe injuries. This revolution is not just a technological achievement. It's reshaping the very nature of how we think about medical care, making what once seemed impossible a reality in our operating rooms and rehabilitation centers. Take the Vinci Surgical System, for example. It's one of the most well-known advancements in robotic-assisted surgery, and it represents the pinnacle of precision in the medical field. As surgeons, we've traditionally been limited by the natural tremor in our hands or the constraints of the human wrist. But with robotic systems like Da Vinci, these limitations are being removed. The technology allows us to perform incredibly complex procedures through small incisions with unmatched accuracy, reducing the potential for human error. We've all been in surgeries where the tiniest misstep could have led to complications, especially in operations like neurosurgeries, where every millimeter counts. But with robotics, we now have a level of control and finesse that was unimaginable even a decade ago. The system magnifies the surgeon's movements, filtering out any tremors and allowing us to work with instruments that can rotate in ways our hands physically cannot. These advancements have translated into faster, more efficient surgeries with less blood loss, reduced pain, and a shorter recovery time for patients. This is where the second phase of this revolution comes in: recovery. We often talk about surgery as the critical turning point in a patient's journey, but the road to full recovery is just as important. Traditionally, patients recovering from severe injuries or invasive procedures would face long periods of immobility, which can lead to muscle atrophy, joint stiffness, and, in some cases, further complications. But today, robotics is stepping in to change this narrative as well. Robotic rehabilitation systems are emerging as game changers in the world of physical therapy. After a patient undergoes surgery, especially for traumatic injuries like spinal cord damage or major bone fractures, the body needs to relearn movements and rebuild strength. Traditional rehabilitation methods can be slow and labor-intensive, relying on manual exercises and the physical strength of both the patient and the therapist. But with robotic exoskeletons and assistive devices, we now have tools that can help patients regain mobility much faster. For example, patients who have suffered a stroke or spinal cord injury may be unable to walk on their own. With wearable robotic exoskeletons, they can now practice walking in a controlled, safe environment. These devices can provide the necessary support to stabilize their movements, allowing them to engage in therapeutic exercises much earlier in their recovery process. And the beauty of these systems is that they can be tailored to the individual's needs. The exoskeleton can gradually reduce the amount of support it provides as the patient regains strength and coordination, giving them a personalized path to recovery that evolves over time. Moreover, the integration of robotics into physical therapy isn't just about physical support. Some systems come equipped with sensors and artificial intelligence that track the patient's progress, providing real-time feedback to both the therapist and the patient. This data-driven approach allows us to adjust treatment plans based on the patient's specific needs, leading to more effective and efficient recovery outcomes. We've also seen the introduction of robotic systems that assist in tasks like limb replacement. Patients who have undergone amputations can now benefit from advanced robotic prosthetics that offer a level of dexterity and control that mirrors natural limb movement. These prosthetics, combined with neural interfacing technology, allow patients to control the prosthetic with their thoughts, opening a new world of possibilities for those who have lost limbs. While we're excited about the potential of robotics in surgery and rehabilitation, it's important to acknowledge that we are still in the early stages of this transformation. Research and development in medical robotics are moving quickly, but there's much more to explore. The integration of artificial intelligence, machine learning, and real-time data analysis could take these technologies to even greater heights in the near future. We envision a future where robots can assist not just during surgery or in post-operative recovery, but in every aspect of patient care, from diagnosis to long-term health monitoring. Imagine a hospital where robots perform routine tasks, allowing doctors and nurses to focus on the more complex human elements of care. Or picture a world where personalized robotic systems can follow patients home after surgery, continuing to assist in their recovery process in the comfort of their own space. These are the kinds of scenarios that are on the horizon as we continue to push the boundaries of what medical robotics can do. In the meantime, we are already witnessing how these technologies are dramatically improving patient outcomes. Procedures that once required long hospital stays and came with significant risks are now being performed with fewer complications and faster recovery times. Patients who once faced permanent mobility loss after catastrophic injuries are now walking again, thanks to the power of robotics. It's an inspiring time to be a part of the medical field as we stand on the edge of a new era where human skill and technological innovation are coming together to achieve unprecedented results. So, as we continue to explore and refine these technologies, one thing is clear: medical robotics is not just the future of healthcare. It's already transforming the way we operate, heal, and recover today. And we're just getting started. When we think about the evolution of medicine, the Da Vinci system stands out as one of the most transformative innovations in modern healthcare. Picture this: we are in an operating room surrounded by cutting-edge technology, where the surgeon doesn't need to stand directly over the patient with a scalpel in hand. Instead, we sit at a console controlling robotic arms with a precision that our own hands could never achieve. This is the reality of minimally invasive surgery, and it's a game-changer for both surgeons and patients alike. The Da Vinci system is designed to perform complex surgeries through tiny incisions. Using high-definition 3D imaging, we gain a magnified view of the surgical site. This enhanced vision allows us to see intricate details inside the body that would be difficult to discern with the naked eye during traditional surgery. Imagine trying to thread a needle from across the room. Impossible with just our hands, but entirely feasible when we have the robotic arms of the Da Vinci system as our tools. These robotic arms are not just mechanical extensions of our own. They improve upon our natural dexterity in ways that are truly remarkable. Each movement we make at the console is translated into precise, controlled actions of the robotic instruments inside the patient's body. Where our hands might tremble slightly or struggle to access hard-to-reach areas, the Da Vinci system eliminates these limitations. It offers us a steady, reliable way to perform surgery with an accuracy beyond human capability. Now, let's talk about the impact this has on the patient. Traditional surgery, as we know, often requires large incisions, which carry greater risks of infection, more post-operative pain, and longer recovery times. The Da Vinci system changes all of that. With smaller incisions, the risk of infection drops significantly. There's less blood loss during surgery, and because the cuts are smaller, the post-surgical pain is far more manageable. This alone would be a win, but the real marvel is how quickly patients can recover. We've all seen patients after open surgery, often in the hospital for days, followed by weeks, or even months of recovery at home. With the Da Vinci system, that timeline is drastically shortened. The smaller incisions heal faster, allowing patients to return to their normal activities much sooner. For example, a procedure that would have once kept someone in the hospital for a week may now only require a day or two of recovery. In some cases, patients can even go home the same day. Beyond the physical benefits, we can't ignore the psychological advantages of faster recovery. The quicker we help patients get back to their lives, the less time they spend in pain, and the less anxiety they experience. It's not just about healing the body. It's about improving their overall quality of life, minimizing the disruption caused by surgery, and helping them feel in control of their health journey. From a surgeon's perspective, this technology also reduces fatigue and strain during long procedures. Traditional surgeries often require us to stand for hours, sometimes in awkward, physically demanding positions. With the Da Vinci system, we can sit comfortably at the console, which can lead to more precise and consistent performance over time, especially in complex cases. It's an advantage that ultimately benefits both the surgeon and the patient. But let's not forget, as revolutionary as this technology is, it still requires skill and training. The robotic arms don't act on their own. They're tools that amplify our abilities. We must learn to master the system, understanding its capabilities and limits, much like any other instrument in medicine. The difference here is that once we do, the potential for improving patient outcomes is extraordinary. The Da Vinci system is not just about cutting-edge technology. It represents a shift in how we think about surgery. We no longer need to choose between effectiveness and invasiveness. With this system, we achieve both. It's precision medicine in the truest sense, tailored to minimize risk and maximize recovery. The fact that we can perform these intricate, life-saving procedures with such minimal disruption to the patient's body feels like we're stepping into the future of healthcare. In the end, what we're witnessing is more than just a technological advancement. It's a redefinition of what's possible in surgery. Less pain, faster recovery, and most importantly, improved outcomes. The Da Vinci system isn't just perfect in theory. It's making perfection feel attainable in practice. So, how exactly does this work? Picture us in the operating room, standing just behind the surgeon, who is seated calmly at a control station. The lights are dimmed, the environment is sterile, and a high-tech robot is looming over the patient. It's not a sci-fi scenario. It's the future of medicine happening right now. The surgeon's hands don't touch the patient directly. Instead, every delicate movement they make is translated into precise, intricate actions by robotic arms. As the surgeon moves their fingers ever so slightly, the robot mirrors these movements with astounding accuracy. There's no shaking, no tremor, no fatigue that typically comes with hours of surgery. It's like the robot becomes an extension of the surgeon's mind and hands. The moment-to-moment focus required is intense, but the payoff is something extraordinary. The surgeon is able to perform maneuvers that are almost impossible with human hands alone. The robot's arms glide across the surgical field with a grace we might compare to a dancer's movements. Except these are calculated, intentional, and above all, flawless. Every cut is not just precise, it's millimetric, as if measured by a laser. The margins are clean, and there's minimal damage to the surrounding tissue. Less damage means less pain, less recovery time, and lower chances of infection or complications. Imagine us watching as the surgeon guides the robot to close the incision. It's like witnessing a master craftsman, stitching with thread finer than the human eye could see. The sutures are so even and so small that you'd swear they were crafted by an artisan. The technology complements the surgeon's expertise, amplifying it in ways that would have been unimaginable just a decade ago. It's a perfect blend of human skill and cutting-edge technology. This robotic precision allows us to push the boundaries of what's possible in surgery. Procedures that once required large incisions and extended recovery times are now performed with minimal invasion, reducing trauma and helping patients get back on their feet sooner. We're moving away from the limitations of the human hand and toward a future where technology and biology work seamlessly together. The result? Surgery that is safer, faster, and more effective. It's not just about convenience or innovation for the sake of it. This is a transformation in how we think about healthcare, how we treat diseases, and how we enhance the quality of life for patients. We're not replacing the surgeon. We're enhancing their abilities. And in doing so, we're changing the future of medicine one precise movement at a time. Since we began using the Da Vinci system, our precision in surgical procedures has increased dramatically. It feels as though we've entered a new era of medicine, where what was once complex and beyond our reach is now achievable with far greater accuracy and safety. We've witnessed firsthand how this advanced robotic technology has transformed the way we approach surgeries. Areas of the body that were previously difficult, sometimes nearly impossible, to access are now within our reach, allowing us to perform intricate procedures with enhanced dexterity and control. The Da Vinci system offers us a level of precision that's almost surreal. Imagine the traditional surgeon's scalpel, held steady by human hands, then multiply that steadiness tenfold. That's the advantage we now possess. We operate through small incisions with robotic arms that mimic the natural movements of our hands, but with finer precision. The robotic arms eliminate much of the trembling or unintentional movements that can occur during traditional surgery, even with the most skilled surgeon. Because of this, we're able to maneuver around delicate tissues and organs with incredible accuracy, resulting in fewer complications and faster recovery times for our patients. It's almost as if we're stepping inside the human body with a set of microtools, guided by the most advanced navigation system. Post-operative complications, a constant concern with any surgical procedure, have significantly decreased. Infections, bleeding, and prolonged recovery times have all become less common since adopting robotic surgery. Patients are back on their feet faster with smaller scars and less post-surgical pain. The psychological impact of this can't be underestimated. When patients are able to return to their daily lives sooner, with fewer reminders of the trauma they've been through, their overall recovery improves, both physically and mentally. But as remarkable as the Da Vinci system is, it's only a piece of the larger revolution we're seeing in medical robotics. What many people don't realize is that robotics is not limited to the operating room. Have you ever heard of rehabilitation robots? These machines are completely transforming the landscape of recovery for patients who have suffered from brain injuries or severe trauma. Imagine the devastation of a stroke or a spinal cord injury events that can strip people of their ability to move, speak, or even perform the simplest of daily tasks. For years, we relied on human therapists who, while incredibly skilled and dedicated, are limited by the physical constraints of the human body. There's only so much repetition, so much precision, and so much strength a therapist can apply during rehabilitation sessions. That's where robotic rehabilitation steps in. These robots are designed to assist patients in regaining their motor functions by offering repetitive, precise movements that a human therapist simply can't sustain over long periods. The beauty of these machines lies in their ability to adapt to the patient's progress. They offer real-time feedback, adjusting the intensity and type of therapy based on how the patient's body responds. This personalized, data-driven approach leads to faster, more effective recovery. Let's consider an example. A patient recovering from a stroke may have lost partial control over their left arm. Traditional therapy might involve repetitive exercises gradually, strengthening the muscles and retraining the brain to control the arm again. But with a rehabilitation robot, the patient can engage in highly targeted movements with the machine, guiding and supporting the limb in a way that encourages optimal neural recovery. The robot ensures that each movement is performed correctly and consistently, something that's hard to achieve with human therapists alone. These robots are more than just machines. They represent hope for patients who might have once been told that they would never regain full function. The sense of agency that comes with being able to move again To feel your body respond to your commands is life-changing. We've seen patients light up with joy as they regain abilities they thought were lost forever. These moments are humbling and remind us of the profound impact technology can have on human lives. And it's not just physical rehabilitation where robots are making a difference. We're seeing advancements in cognitive rehabilitation as well, with robots helping patients recover brain functions like memory, attention, and problem-solving after traumatic brain injuries. These robots can engage patients in interactive tasks that stimulate brain activity, encouraging neuroplasticity, the brain's ability to rewire itself and form new connections. It's like watching the brain rebuild itself, one tiny step at a time. As we move forward, it's clear that the role of robotics in medicine will only continue to expand. We've only scratched the surface of what's possible. There are already prototypes for robots that can perform autonomous surgeries, work alongside human doctors, and even assist in diagnostics and patient care. Each advancement brings us closer to a future where medical care is more precise, more personalized, and more effective than ever before. We're living in a time when science fiction is becoming science fact. It's a thrilling journey to be a part of, and we can't wait to see where it takes us next. The fusion of human expertise and robotic technology is revolutionizing the medical field, and we're just getting started. We stand on the brink of a revolutionary shift in neurological rehabilitation. Robotic technology is opening doors that once seemed closed, offering patients a level of care and recovery we could only dream of a decade ago. Robotic systems, designed with precision and intelligence, are now being integrated into rehabilitation protocols, and we're seeing astonishing results. These robots are doing something profound. They are helping patients recover lost movements by stimulating the brain to forge new neural connections. The process, known as neuroplasticity, is essentially the brain's ability to rewire itself, and these machines are proving to be exceptional at triggering this process in ways that traditional methods simply cannot match. Imagine a patient who has suffered a stroke, whose motor functions have been significantly impaired. Conventional therapies might involve repetitive physical exercises designed to gradually retrain the muscles and brain. While effective to some degree, this approach is often slow, tedious, and limited in its ability to fully re-engage the brain's capacity for neuroplastic change. Now, let's place the same patient in a robotic exoskeleton. The device, carefully calibrated to their specific impairments, guides their limbs through precise, naturalistic motions. Every movement is measured and adjusted in real time, tailored to the patient's neural and muscular feedback. The robot isn't just moving their arms or legs, it's engaging the brain directly, pushing it to form new pathways faster and more effectively than conventional therapy could ever achieve. We've seen it in studies. Research consistently shows that patients who undergo robotic rehabilitation are able to recover neuromotor function more rapidly. In one study, participants using robotic-assisted therapy regained mobility twice as fast as those using traditional methods. These results aren't just statistically significant, they're life-changing. Patients who might have faced years of slow, uncertain progress are now walking, reaching, and even regaining fine motor skills within months. The robots allow for more repetitions of complex movements, and we know that repetition is key to neuroplasticity. The more a patient practices a movement, the stronger the neural connections become, and with robotic assistance, they can practice more efficiently and safely. The beauty of these robotic systems lies in their adaptability. They don't offer a one-size-fits-all solution, but rather they evolve with the patient. As someone begins to regain function, the robot adjusts its assistance, allowing the patient to do more of the work. This dynamic interaction between human and machine fosters not just faster recovery, but also safer rehabilitation. Traditional methods can strain or fatigue patients, potentially causing setbacks. Robotic systems, however, can detect the slightest indication of overexertion and adjust immediately, ensuring that the patient is always working within a safe, optimal range of motion. And we haven't even touched on the psychological impact yet. For many patients, the journey of neurological recovery can be emotionally draining. The slow pace of traditional rehabilitation often leads to frustration and a sense of helplessness. But with robotic therapy, the immediate feedback and visible progress provide a much-needed boost in morale. Patients can see their improvement in real time. Every session feels like a step closer to recovery. This is more than just a physical benefit. It's a mental and emotional lifeline. The confidence gained from such tangible progress fuels further engagement in therapy, creating a positive feedback loop that enhances the entire recovery process. It's important to remember that while these robots are groundbreaking, they are not here to replace human therapists. Instead, they are tools, highly sophisticated tools that augment the expertise and care provided by healthcare professionals. Human therapists bring empathy, creativity, and adaptability to patient care, things that robots cannot replicate. However, by integrating robotic technology into therapy sessions, we're giving therapists more time and more resources to focus on the elements of care that require a human touch. Robots handle the heavy lifting literally and figuratively, so therapists can spend more time supporting their patients emotionally and cognitively. As we move forward, it's clear that the integration of robotics into neurological rehabilitation isn't just a possibility, it's a necessity. The traditional methods of recovery, while important, are simply not enough in many cases. We are learning more every day about the brain's capacity to heal itself, and with the help of these robots, we're harnessing that potential like never before. Every new study, every new success story, brings us closer to a future where full recovery from stroke or traumatic brain injury is not the exception but the expectation. In this journey, we are not just observers, we are active participants in shaping the future of healthcare. By embracing these innovations, we are paving the way for a new era of rehabilitation, one where patients recover faster, safer, and with a greater sense of dignity. Together, with the help of robotic technology, we are pushing the boundaries of what's possible, creating a world where lost movement can be regained and hope can be restored. We're witnessing a transformation in healthcare that few of us could have imagined just a few decades ago. The integration of medical robotics is creating a new paradigm, fundamentally altering the way we approach treatments, surgeries, and even rehabilitation. It's as if we are standing on the cusp of a revolution, one so profound that it's reshaping medicine itself. And yet, it's a quiet revolution, one where humans and machines are working hand in hand, often invisibly, but with remarkable impact. Let's consider the operating room. In the past, surgical precision was limited by human hands. Even the most skilled surgeons could only be so precise. But now, with the advent of robotic-assisted surgeries, we are breaking those limits. Surgical robots, such as the Vinci System, are capable of movements so fine, they exceed the dexterity of any human hand. These robots, controlled by surgeons through specialized consoles, can perform minimally invasive procedures with extreme accuracy. A small tremor of the surgeon's hand doesn't translate to the robotic arm. Instead, it moves with an unparalleled steadiness, allowing us to operate with precision that was once thought impossible. This results in smaller incisions, less blood loss, and significantly reduced recovery times for patients. It's as though we've given the scalpel a technological upgrade, enhancing what the human body is capable of achieving. But it's not just about making surgeries more precise. Robotics is also expanding the possibilities for what types of procedures we can perform. Complex surgeries that would have been deemed too risky or invasive for some patients are now becoming routine. Patients who were once told that their conditions were inoperable now have hope. We can operate on areas of the body that are difficult to access, minimizing the risk to surrounding tissues and organs. This convergence of human expertise and machine precision is fundamentally changing how we define what is possible in surgery. We're also seeing a significant impact on patient rehabilitation. For many, rehabilitation after injury or illness can be a long and grueling process. Traditional physical therapy methods require intense, repetitive effort, often with limited progress. But now, with robotic exoskeletons and assistive devices, we can offer patients new ways to regain mobility and strength. These devices support the body's natural movement while enhancing it. For example, patients who have suffered from spinal cord injuries are able to walk again with the help of robotic suits. It's not just about supporting the body physically, but also about retraining the nervous system, encouraging neuroplasticity, and helping the brain and muscles work together once more. We can't overlook the emotional impact of these advancements either. For patients who had lost hope, robotic rehabilitation offers a renewed sense of autonomy. They can feel themselves improving, gaining back control over their own bodies, and that psychological boost is just as crucial as the physical benefits. It gives them the motivation to keep pushing forward, to reclaim parts of their lives they thought were gone forever. The implications for the future of healthcare are immense. As these technologies continue to evolve, we're moving toward a future where medical treatments are tailored to the individual. Imagine a world where surgeries are not just precise, but also predictive. Artificial intelligence, integrated with robotic systems, could anticipate complications before they arise, adjusting the course of treatment in real time. We're already seeing the seeds of this with machine learning algorithms that can process vast amounts of data, guiding robotic procedures to better outcomes. It's not only in high-tech hospitals that we'll see this shift. With time, the cost of medical robotics will decrease, making these advancements accessible in smaller clinics and even remote areas. We're already seeing early versions of telesurgery, where surgeons in one part of the world operate on patients in another, using robotic systems and internet connections. This could revolutionize access to healthcare, breaking down geographical barriers and offering advanced medical treatments to regions that previously lacked adequate medical facilities. Of course, this fusion of human and machine raises ethical questions. How much control should we give to the robots? Will patients trust these machines with their lives? And what about the doctors? How do we balance the invaluable experience and intuition of a seasoned surgeon with the precision of a robot? These are questions we'll need to grapple with as the technology becomes even more integrated into our healthcare systems. But one thing is clear: the potential benefits far outweigh the risks. We're living in an era where the boundaries between biology and technology are blurring. Robotics is no longer just a tool. It's becoming a partner in the healing process, helping us do things that were once the domain of science fiction. Together, humans and machines are creating a future where healthcare is not only more effective, but also more humane. By reducing pain, recovery time, and invasiveness, we're allowing patients to heal faster, with fewer complications, and with greater dignity. It's a revolution that is quiet, but its effects will resonate for generations to come. We are at the beginning of something extraordinary, a new paradigm in medicine where the impossible is becoming routine, and hope is being restored. We stand at the precipice of a profound transformation in healthcare, one that was once confined to the realms of science fiction. Today, medical robotics is not just a promise of the future. It's a tangible, groundbreaking reality that's reshaping how we diagnose, treat, and care for patients. If we think back to the days when robots and artificial intelligence were the stuff of movies, we could never have imagined the advancements we are now witnessing firsthand. Picture this: a surgeon controlling robotic arms with unparalleled precision, performing complex surgeries through tiny incisions with movements so steady and accurate that human hands alone couldn't replicate. We're no longer talking about general procedures, but life-saving operations that reduce recovery times, minimize pain, and drastically lower the risk of complications. These aren't futuristic dreams. They're happening now in operating rooms across the world. The Vinci Surgical System, for instance, is a well-known name in the field of robotic-assisted surgery. It's revolutionizing everything from prostate surgeries to cardiac procedures. With 3D high-definition views and robotic instruments that offer enhanced dexterity, surgeons can operate with precision that was once unimaginable. And we, as patients, benefit from shorter hospital stays and faster recoveries, ultimately improving our quality of life. But the revolution goes beyond surgery. Robotics is creeping into diagnostics, rehabilitation, and even daily patient care. Think of robotic nurses that can assist with routine tasks, monitoring vitals, administering medications, and even offering companionship to those who are bedridden or isolated. These machines aren't just tools, they are partners in delivering care, taking some of the burdens off human healthcare workers and allowing them to focus on more complex, patient-centered tasks. And the innovations don't stop there. Imagine artificial intelligence working hand in hand with robotics, analyzing vast amounts of data to provide precise, personalized treatment plans. With AI, we're looking at an era where machines can detect abnormalities in scans that even the most experienced human eye might miss. AI systems can predict disease outbreaks, track patient recovery trends, and optimize entire hospital systems to run more efficiently. We're also seeing robotics make waves in rehabilitation. Robotic exoskeletons are helping paralyzed individuals walk again. With these wearable robots, people who once thought they'd never walk are taking steps, regaining strength, and reclaiming independence. This is no longer a dream. It's a reality that's giving hope to millions. Yet, with all these advancements, we must ask ourselves, what's next? Robotics, combined with the exponential growth of AI and machine learning, will only continue to evolve. Will we see fully autonomous robots performing surgeries in the future? Possibly. Could we witness AI-driven robots diagnosing diseases with unparalleled accuracy? Likely. And what about nanobots swimming through our bloodstream, delivering targeted therapies to destroy cancer cells or repair damaged tissues? That may not be as far off as we think. What's clear is that the integration of robotics in healthcare is still in its early stages. We are witnessing the dawn of a new era, where technology and medicine merge in ways that we never thought possible. The challenges ahead will be complex: ethical concerns, training requirements, and accessibility issues, to name a few. But the potential is limitless. This revolution in health is not just happening in labs or high-tech hospitals. It's happening around us right now. As we continue to embrace these advancements, we must also prepare for the profound changes they will bring to the way we live, work, and care for one another. For those of us who are excited by this revolution, staying informed is crucial. These innovations are unfolding rapidly, and the best way to understand their implications is to keep up with the latest developments. We're just scratching the surface of what's possible, and the future promises to be even more astonishing. So, if you want to dive deeper into this world of medical technology and stay on the cutting edge of healthcare innovation, make sure you subscribe to the channel, hit that notification bell, and don't miss out on the incredible advancements yet to come. The revolution in health is just beginning, and we're all a part of it.